I feel like I should be singing holding this microphone, so, and I talk really loud and I talk a lot, so when Sean commented about not talking too much, he was directing that at me. You're probably wondering why a surgeon's talking about foals. It's kind of my hidden passion. I absolutely love foals. I probably should have been in medicine because foals there's nothing more rewarding than taking a sick foal that comes to you that's going to die and saving it and sending it home. The same way with colics, that's my other passion. Unfortunately, we're not in a position to be able to cut colics right now, but it's probably my favorite surgery to do. So we're going to talk about foals today, and I had to laugh. Who was the gentleman that asked whether or not brood mares ought to be adjusted? If you had ever carried a foal, that would not be a question you would have to ask. So take it from me. I have carried a couple of foals, and I threw my back out. And I mean, I've hauled horses on and off the table for 15 years in practice and beat myself to hell. And carrying the foal was the hardest thing ever on my body, and I still have not recovered 8 years later. And if it wasn't for chiropractic and massage and active release therapy at least once a week, I would be non-functional. And it's funny because I will admit, as most large animal veterinarians, we do not believe in alternative medicine. I was raised in a Western medicine culture, and nothing made me appreciate colics till the first time I colicked and ended up acutely in the ER. And I thought, oh my God, if that is what my patients experience, it gives you a whole new light for what acute colic means. The same thing with the massage and chiropractic. Once I started needing it to be functional, I mean, it's kind of amazing. I don't even know how people get along without it. And if there's anybody here that sits in this room that doesn't have a pain somewhere, well, you got to be praising somebody, because I don't know what that's like. So let's talk about foals. Okay, I know my talk is called 0 to 6 months, but you don't get to 0 without foaling. And I think something that we really forget is the first 24 hours of that foal's life is critical to the health of that young foal up to 6 months and even beyond. So we're going to spend a little bit of time talking about foaling. How many people in the audience have foaled out a mare, raised a foal from 0 to 6 months? Okay, so a fair number of you. Hopefully my talk's not going to be near as technical as the last 2 talks, even though I like to talk technical. I tried to write this talk to kind of the whole audience, so if you guys have some specific questions in the end, I'm happy to address those. So the average length of gestation for a mare is 336 days. Really important as far as getting that mare up to speed for foaling, that she gets adequate exercise. It's no different when you're late pregnant. You need to be up and walking around. You need to actively be toning those muscles. You can ride these mares up until the time they foal. The last month of their gestation, you don't want to do any real heavy exercise, but you can tack them up and ride them right till the very day that they foal. It's important that you also maintain hoof care, because she's got to walk around for 11 months with this foal in her belly. Don't forget about their feet, and thank God she's just a brood mare, and throw her out to pasture. Preventative health care is critical. She's got to have teeth that grind appropriately to be able to have adequate nutrition to carry the foal. So you've got to think about her nutrition levels. That changes while she's pregnant, especially in the last third of her pregnancy. Vaccination, various vaccines that we give, especially when they're pregnant, to prevent things like abortion from herpes virus. And also they need to stay on a good deworming program. And then critical, which we've had a few clients that forget that, oh crap, my mare's sewed up in the back, and all of a sudden here comes the foal's feet, and then you've got a big mess behind. So don't forget that if your mare's got a caslix, about a month prior to foaling, you do need to have the caslix removed. It's real important for the mares to be either in a large stall, so minimum of 12 by 14, ideally a stall with more space than that, or a grassy paddock to foal. We prefer straw over shavings, mainly for the respiratory problems that shavings cause. You think about a foal that's laying on the ground once it's born, you don't want them to be in the shavings. It's really nice to feed these horses on the ground. I'm not a big fan of manger feeding or even hay net feedings unless they're race horses, just for logistical reasons on the track. They really need to be eating on the ground. It's the way that their body naturally gets rid of all the dust and pollen and everything that gets into their trachea and up their sinuses when they're just walking around the stall. So it's really important that they be fed on the ground. And then how many of you guys are familiar with the foal monitoring systems? Okay, these are really great, especially if you've got a mare whose foal is worth anything. And most people nowadays, if you're breeding foals, the foal's worth something, right? And you're not there 24 hours a day. Most people don't have video monitors in their stalls, but this is a really nice tool. You suture it into the mare's vulva, and it's hooked up to a bunch of different telephone numbers. And when the mare's water breaks or the mare goes into labor, it calls you. So it's really nice. It'll also call your veterinarian too, so you all show up there at one time. So it's kind of a cool deal. Yeah, just don't put it on your wife. You put it on your mare. A foaling kit is something really nice to have in place, and these are basically the supplies that you might need as an owner for a mare that's foaling in case there are any problems, but also waiting for the veterinarian to get there. There are some things that you can do. There are some things if you call me and say, hey, this mare started foaling 20 minutes ago, the foal's not on the ground, I'm going to say, hey, do you have a pair of gloves? Do you have some sterile lube? Put it on, stick your hand in her vagina, try to feel, are feet coming first? Do you not feel anything? What's going on? So important to have your veterinarian's phone number and any other emergency phone numbers you may need. A charged cell phone, because that really bites when you need to be in the barn and you don't have a phone. A flashlight or headlamp, especially if the mare is not in a lit barn. A vet wrap for wrapping the mare's tail when she foals. It's just to help keep her tail clean and keep everything out of the way. A string or scissors and a knife. Anybody know what that's for? What's that? Okay, umbilical cord, that is one reason why. But the biggest reason that you're going to do on every single mare that foals, as soon as that mare stands up, you want to tie that placenta up to about the level of her hocks, so she's not walking around on it. She walks on it, she tears it, she leaves fragments of the placenta in her uterus, you've got a mess on your hands. So put on some gloves, or don't, if some people like to get all messy and get in the middle of things, but ideally put on some gloves, just wrap it all up, tie a string around it, and let it hang there. Whatever you want to do, and we'll talk about this in a little bit, as you don't want to pull it out. Gloves and sterile lube, in case you want to help your veterinarian and try to figure out what could potentially be going on if she's having a problem. Clean towels in a bucket with a lid. You want to save that placenta for the veterinarian when they come out to do the foal check. So just rinse it off. If it's covered in shavings, put it in the bucket, put the lid on, and that'll be there tomorrow when the veterinarian gets there. For the foals, a pediatric enema. So we recommend to have at least one of those on hand. Just a lot of foals have trouble passing their meconium, so it's good to have an enema on hand. And then antiseptic dip and a syringe case. So a 12 cc or 35 cc syringe case is perfect. The umbilicus fits right in the end of it. You can dump it out, wash it, and save it every day. And then the antiseptic dip, it just kind of depends on what your preference is. We don't like using strong iodine, which a lot of the old veterinary textbooks that tell you to use strong iodine. That tends to cauterize the umbilicus, makes it more prone to getting infected. Use either a dilute Novosan or a dilute betadine solution for that. Okay, so signs of impending foaling. Within the last month of foaling, you might first notice that the mare's behavior starts to change. They don't really have nesting behavior like people do, but they will start to get restless, start to not want to be around other horses, maybe being pissy towards the other horses that they're turned out in the pasture with. About the last week, you will feel, if you feel up along the tail head and along the vulva, you will feel that those muscles are all starting to kind of relax, and that's an effect of the relaxin hormone that's released. Their udder will start to distend. Most of you guys are probably familiar with the term waxing. We don't really see that until about 3 days prior to foaling in most mares, but they will get some dried colostrum on the tips of their teats. It's what we call waxing. Relaxation of the vulva, that usually occurs within 48 to 72 hours. And then once the restlessness and sweating and pacing starting, hold on, because it's time. So 3 stages of labor. The first stage is once that foal, most foals in the womb are on their back or maybe over on their side, but they're not in a position, they're not like babies and humans where they start positioning themselves months before. You know, if you go in to get checked and the doctor says, oh, you have a breech baby at 6 months, you're probably going to have a breech baby when the time comes. Foals are not that way. That last day, they really start to turn and position themselves to come out, and these mares can get really, really uncomfortable. So the first stage of labor is while that foal is being positioned. Once that mare lays down and you start to see this nice, clear white sac coming out the back, that's the allantoic sac. That's the inner sac that actually the foal is contained in. You can see that it's got amniotic fluid. It's like a big bag because it's full of fluid. Once you get to this stage, she's having active abdominal contractions, active uterine contractions, and you are in stage 2 labor. Part of the reasons why you need to have a watch on is once the mare gets to this stage, that foal needs to be out and on the ground in 15 to 20 minutes. Not half an hour, not 45 minutes, 15 to 20 minutes. It's quick. I mean, these horses are, God meant them to live out in the wild. Those foals have got to get out, get up, and get on with it pretty quick or they're going to get eaten, right? So 15 minutes, if that foal's not on the ground, you need to be calling somebody to come help you. Okay, so again, the things that they're going to do in the first stage are the obvious. They're going to look like they're colicking, except you know that they're ready to foal, so you know what they're doing. Typically 1 to 4 hours from the beginning of stage 1 till we get through. In some mares, it'll be 10 hours. I mean, some of these mares are really uncomfortable for a while. Once you get rupture of this membrane, then you're officially in stage 2. Okay, so second stage, again, strong contractures of the abdomen and of the uterus. So these foals should present front feet first. Ideally, they're coming out with the top of their head to the top of the mare. So they're coming out just like this. Usually one foot is a little bit ahead of the other, so they don't always present with both feet at the same time. They're usually staggered a little bit, but the head ought to be between the legs. The other amazing thing to me about mares is they can foal standing up. I mean, anybody in here who's had a foal, you cannot do this standing up. I don't know how they get it done. You do need to be there, though, because if they drop the foal standing up, it's pretty traumatic on the foal. That was mentioned in the chiropractic talk. But these mares, you need to kind of just grab the foal and help them to the ground. If they push hard enough, that they foal standing up. As you can see here, this is the allantoic sac that is already torn. The foal is turned a little bit sideways, which occurs sometimes, but this is a normal presentation for the foal. Usually 10 to 60 minutes, but again, if it's not progressing rapidly within 15 to 20 minutes, you need to call somebody, because don't forget, it's going to take a little bit of time for your vet to get out there. So don't wait too long. Okay, third stage, foal's out, everything looks good, and now we're just waiting on the placenta to pass. In general, this is going to take about 4 to 6 hours. When you start getting past the 6-hour point, we get worried about either the mare's not got enough oxytocin release, she's got an infection, she's got something going on that's causing this placenta not to come out. Mares do not tolerate retained placentas. Cows don't either, but mares are less tolerant than cows of this sort of thing. So if any of you guys have any experience with cows, this is a different deal. We really want that placenta out by 6 to 8 hours. So at 6 hours, if it's still hanging there, you've got it tied up, you need to be calling somebody to come and potentially induce it and get things moving. So again, an important reason to have a clock. Do not pull. Place it in the bucket with the lid. Note how long it took for it to come out. The other thing that's really critical in the first probably 4 to 6 hours after foaling is to keep a really close eye on the mare. There's a lot of things that can happen internally that you don't appreciate externally when these mares foal. They can get a piece of small colon kind of stuck into the pelvis, and when they have a tight abdominal contraction, it can actually tear part of the small colon. They can rupture their uterine arteries. They can have all sorts of things that go on, so you need to watch them very closely. It's not uncommon to have discharge from these mares for 4 to 5 days post-foaling, dark red discharge, and also they should be continuing with normal fecal production. If a lot of these mares will colic, mild colic, paw, pace, look a little uncomfortable right after they foal, that's normal. Again, anyone here who's gone through that realizes this is not the most comfortable feeling in the world, but you have a lot of oxytocin release. So you're gonna feel the effects of that. And the first time the foal gets up in nurses, some of these mares will get a little colicky again from the oxytocin release. But if they're really acting like they're not comfortable and it tends to be a consistent thing, that's something to be concerned about. So I mentioned a few of the potential problems. This is actually a picture of a ruptured prepubic tendon. This usually occurs prior to foaling. But this can create a real problem for the mare not being able to push appropriately. So I just put this picture in here because it's not something that you'll see real commonly. You can have premature placental separation where the whole placenta disconnects from the uterus. It shouldn't do that. And so now all of a sudden you've got a situation where there is no connection between the placenta and the mare, and the foal is still inside the bag. So the foal is not breathing on his own yet, now has no blood flow, now has no oxygen. This is an emergency situation. So this is what we call a red bag. If anybody's heard that term, that's an emergency. We talked a little bit about intestinal problems in these mares. The other thing that happens actually on a relatively, I don't know, Sean, we've probably seen at least one a year, is these foals come through, and it's amazing how forceful the uterine contractions are on these mares. But as they're coming through with their front feet, they get a front foot and they just stick it right up through the top of the vaginal wall or the uterine wall, right through the rectum, and they keep going and everything comes with it. So all of a sudden, this nice little foal is born and the mare gets up and she's got one big hole in the back end. Sometimes they stick it up through the rectum and pull it back out, and then they come out the vaginal opening normally. You wouldn't notice that, except all of a sudden you notice she's got fecal material coming out of her vagina the day after she's foaled. So sometimes they just have a hole there. They don't rip the whole backside out. So that's something else to consider. And then bleeding problems are actually relatively common, and every couple of years we'll get one that just acutely dies after she falls from a uterine artery rupture. So you need to keep that in the back of your mind as well. This is the appropriate place to talk about what a premature foal is. So as I mentioned, average gestation time is 336 days. It can range anywhere from 300 days to 365 days. Mules and donkeys tend to go a little bit longer. There are some mares that carry 12 months instead of 11 months. So it's kind of nice to know what the history of the mare is. We consider anything under 320 days premature. Usually anything that's about less than 310 days is not viable, just because so much of the surfactant production, lung production, organ production happens in that last 2 weeks of gestation. But what you're going to notice on a preemie foal, even if the mare went 336 days, but this may be a mare that tends to go 350 days. So technically that foal is going to be premature. They tend to be small, weak, and thin. They have a really short, silky hair coat. It's not like what you see on a normal foal. It's really very silky. Floppy ears, they can't hold their ears up. If you stick your finger on the inside of their nasal passage, you should get a pretty prominent withdrawal reflex. They will not respond to that. Many of these foals will have flexor tendon laxity if they're walking on the back of their fetlocks. Some of them, their hooves are actually flipped up off the ground. They can have seizures. They're very prone to joint infections. Some of these foals come out septic. And this is a radiograph here of the carpus on a foal. These bones should be cuboidal, what we call cuboidal, so they should be square-shaped. There shouldn't be any of this area in between the bones. That's all cartilage. That's what we call incomplete ossification. And this is one good way, just taking an x-ray of these foals to really see how premature are they. This foal is not going to be able to stand up and bear any kind of weight on its joints because it's all cartilage. Nothing's ossified yet. So it's probably 2 or 3 weeks premature. Okay, so in the first 24 hours of a normal foal, what are we expecting? That foal ought to be up and nursing in how many hours? Anybody have an idea? Okay, yeah, 4 hours. I mean, ideally, most normal foals are going to be up and nursing within the hour. Most foals, by 30 to 45 minutes, they're trying to get up. They get up, they start scooting around. Because of the pheromones that the mare releases from her mammary gland, they know exactly where to go, and they start rooting around and poking around. By 2 hours, you should start getting a little bit concerned if that foal's up and not finding where they're supposed to be going. I try not to intervene. I mean, I think for the most part, if things are going the way they're supposed to go, don't get involved. Don't feel like, oh, I need to get in there. I need to imprint this foal. It's only been an hour. Give the mare and foal a couple hours to do their thing. She's going to lick the foal dry. They're going to get to know each other a little bit. Pay attention to the mare's behavior. But ideally, we want that foal up and nursing within 1 to 2 hours. So 2 hours rolls around, and maybe the foal's slow. He's getting up. He's trying to find his way around. You can get in there and kind of show them, kind of get them over there to where they need to be, help them get their head up, milk the mare a little bit, get her to have a little milk let down so she's streaming, and try to get the foal to hook up. By 4 hours, if that foal has not nursed, we've got a problem. Ideally, these foals need to get colostrum within the first 6 hours. So colostrum is the mare's first milk that has all the immunoglobulins and antibodies that foal needs to be protected in the early stage of life. So it's critical that they get colostrum. So by 4 to 6 hours, if that foal hasn't nursed, the ideal thing would be to get the veterinarian out there, get the colostrum collected, get the foal tubed, and make sure that it gets adequate colostrum. When you get out to 12 to 24 hours, that foal is now becoming hypoglycemic. They're weak. If they're born at a time of the year when it's cold, now they're hypothermic. And now you've got all the factors that set them up for septicemia, maladjustment syndrome, all of these problems that are kicking in very, very quickly. That first 12 hours is critical. Make sure they get up and get nursed. If not, we need to get some milk in them. So during 24 hours, they're also going to pass meconium. The first meconium that comes out can be very, very black and tarry looking. Sometimes it looks like tapioca pudding. I hate comparing poop to food, but I don't have another good comparison. So it can look like tapioca pudding. It's very, very sticky. It'll stick to you. It'll stick to the straw. It'll stick to the foal's butt. You can wipe the foals, gluteals down with some Vaseline just to keep them clean. Sometimes this meconium, because it's so clay-like, it's very difficult to pass. And especially if the foal is not nursing heavily, they may be a little bit dehydrated. This is when you can lube them up and give them a little bit of a pediatric enema. The key with the pediatric enemas is it's not a lot of volume and the enema is not very big, so you're really not going to do any damage with it. One enema, usually within half an hour, they'll pass. If they start to get colicky, obviously that's a reason to call somebody. Also, urination. They ought to urinate within the first couple hours that they're born. As soon as they nurse, that ought to stimulate their kidneys to release, and they ought to urinate. Especially on males, you want to make sure that they're urinating out of their penis and not out of their belly button. And sometimes, amazingly, on those little guys, it's hard to tell which is which. So get under there, figure it out, make sure they're urinating out of the right hole, because a patent urachus is something that's a serious problem in these guys. So you want to make sure that they're peeing out of the right place. And then again, especially if this is a maiden mare, you want to monitor the mare's behavior. Make sure she's not going to kill the foal. I mean, it's amazing. Some of these maiden mares, they can be nasty. And it's real important in those horses that we get the foals off and get them on either a supplemental mare, a reset mare, or start bottle feeding them if the mare's not going to tolerate them. Okay, we talked a little bit about dipping the navel. Ideally, and we didn't really talk about placental and umbilicus, but once that foal hits the ground, a lot of people want to get in there, get them disconnected, get the umbilicus cut off. There's a lot of blood flow that happens even after the foal is delivered. So you need to give everything about 30 minutes to 60 minutes to let that blood get out of the placenta, get into the foal. Normally, once that mare stands up, the placenta is going to break from the umbilicus at its natural spot, which is usually 4 to 6 centimeters from the body wall. You really don't want to get too involved in trying to assist that procedure unless there's a problem. The foal's bleeding or it doesn't break when it's supposed to break. Assuming that it's broken during the first 24 hours, you want to dip it about every 6 to 8 hours. You want to make sure that you're handling everything as clean as possible because the umbilicus is probably the #1 source of bacterial contamination in these foals. So that's where your nidus of infection comes from for pneumonia, for joint infections, for all sorts of problems. So you want to be really clean when you're doing that. Again, you want to monitor nursing frequency and aggressiveness. That foal ought to be getting up at least once an hour, and when it latches on, it ought to latch onto both sides, and it ought to be very aggressive when it's nursing. You ought to hear a good, strong suckle reflex. You ought to see the mare let down milk. A lot of times when the foal nurses from one side, she will let down milk from the other side, and you want to make sure her udder is getting flattened, you know, that the foal's getting a full feeding. Monitor defecation and urination. Again, they can get meconium impactions that won't show up till 24 to 48 hours after birth. So they may pass the first meconium, but there's quite a bit of fecal material in the large colon and small colon in these little guys, and it takes them a day or two to get all of that out. So you can have meconium impactions that are what we call low impactions that are just back by the rectum, or high impactions that are in the colon, and they can be pretty painful. Monitor the health of the mare. By this time, usually if the mare is going to have any major health problems, by the time you get out to 24 hours, kind of your real critical period is over for the mare, but you want to continue to monitor her for colic and that sort of thing. Anybody know what these are? These little things on the feet.
They protect the uterus when they come out.
Okay, so yeah, so we call them feathers. They are very soft, cartilaginous. They're from the embryonic hoof development. They are not abnormal. I had a guy in Chicago that killed the first 3 foals he had because he thought something was wrong with their feet. And he called me out for the 4th one, and he's like, I don't know what's wrong. Every single mare I've had, and I'm like, oh my gosh, what are you doing? Read the books before you start breeding. Totally normal. Usually these are gone within 12 to 24 hours. Once the foal gets up and starts walking around and moving, they fall off very quickly. But for people that don't know what it is, it can be a little bit confusing. Nothing abnormal, though. Okay, and then for your veterinary exam, ideally you want to have a new foal exam by 12 hours. So 24 hours at the latest. And basically the critical parts of the exam are obviously just doing an overall exam, looking at the eyes, the umbilicus, the musculoskeletal system, neurologic, strong suckle reflex, taking a temperature, listening to the heart for potential congenital problems in the heart, assessing the lungs, making sure the lungs are expanding normally, an IgG test to make sure that the foal got adequate colostrum. That is critical. they can suckle, and the mare's colostrum cannot be good. So you want to make sure that that foal got adequate colostrum. So what we do is, it's a simple blood test. We just measure the antibody levels, and just as long as they're over 800, then that's considered normal. The key is if it's not above 800, then you need to make a decision. Do we give this foal plasma? Do we do something to boost his immunity? Because if not, he's susceptible to all sorts of infection. He basically has no immune system if he didn't get his mother's colostrum. So that's critical. And then a lot of people will give a tetanus antitoxin, even if the mare was boosted. I don't know if that's something that you do commonly in your practice or not, but some people just do that routinely. Okay, so we finally got the foal on the ground. We're past the 24 hours. Everything's going good. The next 2 months is kind of coasting. Mare's taking care of the baby. Baby's doing his thing. He's getting up and nursing every hour. After a few weeks, he's starting to root around, check out mama's feed, check out what's in the bucket. He's starting to get used to this stuff. He's like, man, that's pretty cool. He's trying to kick your head off every time you walk in the stall. And then you call the vet, and he's trying to kill the vet. And things are going good. So he's growing strong, he's nursing strong, he's showing interest in mom, and then about 10 days, this happens all over the place. And you get phone calls, what in the world's going on? So about 7 to 10 days post-foaling, these mares come back into heat, and these babies get scours, and it's nasty, and it stinks, and it's all over your stall walls and all over the straw. Otherwise, foal's doing great. Foal's still nursing, temperature's normal, is running around, doing great. Not to be concerned. The time that you want to be concerned about diarrhea is when they stop nursing, they're starting to get lethargic, they're not wanting to get up and nurse. That's a problem. Dr. Strain, do you have a comment about that? About scours? Okay. That's your specialty, right? I'm just kidding. Yeah. The other thing that really happens, especially in the first couple of weeks, is these foals really their legs start to strengthen because they're running around now, they're scooting around the stall. They need to have some turnout at this time. It's really not good for these foals to stay in a stall all the time. That's why a little bit larger stall where they can run around and get some exercise in the stall is good. This is a critical time where you want to start watching their joints. So I don't know if you can tell, but this foal down here has got pretty swollen hocks. If they're going to have septic joints related to something that happened at the time of birth or exposure through the umbilicus, it's going to happen relatively quickly, usually within the first couple of weeks of birth. And the first thing you're going to notice is the joints are swollen. Second thing you're going to notice is these foals aren't wanting to get up because they hurt. And then they run a fever, and then they get lethargic, and then they go off, and they stop nursing, and then you've got a mess on your hands. So should be checking these joints every single day. Check the hocks, check the knees, check the fetlocks, check the stitches around the joints. That's a reason to be concerned. Catch it early. That's the key thing, and I'm going to keep reiterating that over and over again. Also, you want to keep a really close eye on that umbilicus. It ought to be drying up, shriveling up, and going away within a couple of days. Okay, so if you have continued moistness or if you notice urination through the umbilicus, that's something that needs to be addressed immediately. And then again, the diarrhea, other than the scours that you're going to see between 7 and 10 days when that mare's in heat, their feces ought to be fairly normal. They're not going to be like adult feces, but they're going to be formed. They shouldn't be runny. So if you see that, that's a reason to be concerned as well. You're going to hear me kind of repeat the same things because from 0 to 6 months, as far as infectious disease, it's the same things over and over again. We're watching joints, we're watching for diarrhea, we're watching for lung disease. That's really what foals get. They get lung disease, diarrhea, and joint disease. From 0 to 2 months, there's a lot of things that can happen with these little guys. Again, their tendons are getting strong, their ligaments are getting strong. A lot of them are born with crooked legs. When you're examining a foal, one of the things to remember is you want to get in the same plane as the joints. So if they're standing like this, you can't assess which joints are crooked and how they're standing by looking at them front on. You've got to be in the same line as their legs. A lot of these foals will straighten up after a day or two of exercise. Some of them won't. A lot of foals end up needing this sort of treatment with splints and bandages to help them, especially if they're contracted, and I'll show you some more pictures of that. Again, the same things as I've already talked about between 0 and 2 months. What we're really looking for is the infectious disease things that happen. A lot of foals will get colicky. This is your typical colicky foal from meconium impaction. They get gastric ulcers. We talk about ulcers in adults, but ulcers in foals is a serious problem. We probably lose half the foals that we have in the hospital for serious problems due to ulcers. And they rupture, and all of a sudden they start bleeding out the nasal tube or bleeding. You have faint blood coming out of the mouth from a bleeding ulcer. So it can be a real problem. Deworming is critical between 2 and 6 months of age. You need to talk to your veterinarian about what deworming program these foals ought to be on. They're very prone to ascarids, to roundworms. As you know, adults develop immunity to roundworms, so rounds are not such a big problem in the adults, but they are in the babies. So you need to be using something other than an ivermectin and a moxidectin in these guys. So talk to your veterinarian about that. Also talk to your veterinarian about what age are we going to start vaccinating. You have to remember, because the foals have the mare's colostrum, they have a certain level of protection for the first couple of months of life. And immune protection in foals is a little bit of a bell curve. And you never know when that immunity is going to start to wane. In some foals it may start to wane at 2 months, in some foals it may wane at 4 months, in some foals they may have pretty good protection until 5 or 6 months. The critical thing is once you start to vaccinate them, they can't respond to the vaccine if they have maternal antibody, because those antibodies are binding the antigen from the vaccine. So that's why we have to give foals 3 and 4 rounds of vaccines versus an adult that we just give 1 or 2 rounds, because they can respond immediately. So it's critical that you start these foals off before all the maternal antibody is gone, because then they're susceptible. So they have to have a first shot and respond, and then they have to have a booster to boost the immune system to really get enough response that they can fight infection. So most people will start vaccinating, I don't know what you're recommending, but most people start between 4 and 5 months on first round. What most of you guys are doing. And then think about creep feeding and weaning. The other thing a lot of people don't think about is they're going to plan to wean these foals at 5 or 6 months, and they're just going to wean them and start them on grain. Well, you talk about stress, all of a sudden now you're taken away from your mama, and now we're going to change your diet, and all sorts of messes happen. So start creep feeding these guys at about 2 or 3 months of age when they're still on the mare. Again, I'll reiterate continued risk for all of the infectious diseases. 2 to 6 months is when we start seeing problems with pneumonia, rhodococcus pneumonia. They can get strep zoepidemicus, which is the #1 bacterial organism in the horse. They can get strep equi, which is strangles. This is actually a picture of a horse with a guttural pouch, what we call a guttural pouch empyema. So his guttural pouch is full of pus from a strangles infection. And all of these things are occurring near the time that they're born or in the very early stage of their life when their maternal antibody starts to wane. And all of a sudden now they become susceptible to all of these things. Again, diarrhea, your viral diseases. 2 to 6 months is when you ought to start looking for the really common things that we see, which are umbilical hernias and crypts. So a lot of people say, you know, horses' testicles aren't down by 2 years, they'll come down. They ain't coming down. If you can't feel them at 6 months, they ain't there, and they're not going to be there. They're not going to be there in a month. They're not going to be there in 6 months. So by 6 months, if there's only 1 testicle or no testicles, then you just need to start thinking about, okay, what are we going to do, because this is not going to be a simple castration. The umbilical hernias, there's a couple of things that you can do for these. You can actually, if you've handled the foal enough that you can get under their belly and manually reduce those hernias, massage the hernia, stick your fingers up in the rim, really aggravate those things. A lot of times they won't completely go away, but they'll reduce to a significantly smaller size, which are much easier to deal with. I mean, doing surgery on a hernia like this is much more difficult than doing a surgery on a hernia like this, because you've got to get that body wall closed. So it's really good if you guys can keep an eye out for these, and if they occur, start early at 2 or 3 months and just every day massage those things. And then by the time they're 6, 7, or 8 months, when you're looking at doing surgery, then it's a lot easier to do. So we typically don't fix hernias and crypts before 6 months of age. A lot of them we wait until, well, the hernias we won't wait until they're yearlings. We typically do them younger, but some of the stallions or the colts, we wait until they're a year old just because of timing of the year. You have to be able to get a halter on them and at least handle them to some degree, and a lot of these little guys are a little bit difficult to handle. So just this is about the time you want to start thinking about what you're going to have to do over the next 6 months. All right, I'm going to divert here a little bit, and I'm not going to spend a lot of time talking about developmental orthopedic disease, because I could talk to you for a week. I could talk to you a week about anything, but especially DOD. There's a lot to say about it. But I think it's really, really critical, and I bring it up here because you're not going to see a lot of developmental orthopedic disease between 0 and 6 months, but what happens to these foals from 0 to 6 months sets them up for developmental orthopedic disease later in life. It's more disease of your 6-month to 2-year-old. But I want you guys to be aware of it so you know what to look for, you know what's common, and you know some of the factors that predispose to development. I mean, developmental orthopedic disease is the #1 thing we deal with in young horses. It is a syndrome. There's multiple factors that affect it. Genetics plays a role. There's been a lot of studies done on genetics in horses and DOD. There was a really big stallion in Europe that all of his babies had OCD. Every single one of them. He never had OCD, but all of his babies had OCD. But it's one of those things that you can't always replicate. But there is a genetic predisposition. There's a huge nutritional predisposition to developmental orthopedic disease, so it's really critical that you monitor the nutritional plane of these foals as they're growing. They shouldn't stay on the same nutritional plane all the time. When they go through a growth spurt, people think, oh, they're growing, we ought to feed them more grain. Nah, they're growing, slow down. If you start pouring the grain to them and they're going through a growth spurt, then you get fasciitis and you get OCD set up. The long bones of the horse, all the growth is done at the end of the long bones in these foals. So by the time they're born, most of the long bone in the center of the bone is all the growth is done. So the growth is occurring at the ends of the long bones. So there's a growth plate at the end of the cannon bone, there's a growth plate at the end of the radius, at the end of the tibia, at the end of the femur. That's where they do all their growth from. There's cartilage there that's constantly being turned over into new bone. That's how they grow. And as the cartilage expands and the new bone grows, the bone elongates. The nutrition plays a huge role in whether or not that cartilage becomes bone. And if you're pushing the carbohydrates to them and they're not getting the right combinations of calcium and phosphorus, they can start having problems with that. So just keep that in mind, that nutrition is a huge problem. I just show you this. This is a typical what we call a windswept foal, where both of the legs are going the same direction. Angular limb deformities are very common. I think I've got another picture in here. This is what we would call a carpal valgus, and if you get in the right plane and look at these foals' ankles, they're crooked as well. A lot of these will straighten out, but some of them won't. So when we're talking about the fetlock, ideally, you've got to get in there and do something with those surgically by 6 to 8 weeks of age, so really early. By 6 weeks, if you don't get in there, then you end up having to use screws and wires and doing something a little more aggressive to get them to straighten out. For the knees and the hocks, you've got a little bit longer, about 4 to 6 months. We have a couple of different surgical procedures. The periosteal stripping is basically a fairly non-invasive procedure. It'll correct mild to moderate deformities. You just have to get on them pretty early. I'll just mention here the flexural limb deformities. All of you guys have seen the club foot. This is caused by a flexural deformity in the deep digital flexor tendon. This is classic superficial digital flexor tendon, where you get this bowing at the fetlock. And then we also see it in the carpus and foals. So you can get different levels of flexural limb deformity. And again, there's surgical treatments, there's non-surgical treatments. Some of the critical things that we do are hoof trimming. We have these glue-on shoes that we can make that a lot of times will help correct those deformities. Splinting works amazingly well. Here's some before and after pictures of just what splinting will do. Oxytetracycline injections, and again, surgery in severe and non-responsive cases. For all of these, it's critical to remember that a controlled exercise program and nutrition plays a huge role, so you want to talk to your veterinarian about that. I'm not going to spend a lot of time on this because we already talked about fasciitis, but I just wanted to show you this picture. This is where the growth plate is. These are the carpal bones. This is the distal radius. This right here is the growth plate. And you maybe can see this is fairly normal looking right in here. This is really not happy growth plate here. So this would be a lame foal with epiphysitis. And again, I'll just mention osteochondrosis. Again, we don't see this much in 0 to 6 months, but the really common problem as an end result to developmental orthopedic disease in the six-month-old to 2-year-old. And it can be anything from fragments of cartilage and bone right here that didn't form properly. This is a piece inside the joint arthroscopically. This is a shoulder in a horse. This is actually the trachea and the shoulder joint. And you can see this big lesion here. There's a lesion here in the scapula and a lesion here in the humerus. So again, the take-home messages, what happens with the foal during the first 24 hours is critical to the early health and survival of the foal. So you need to be there when that mare foals, and you need to be adhering to all the good principles of healthy newborns during that period of time. Nutrition and exercise and management during the first 2 to 6 months is critical to the long-term health. And again, the importance of early diagnostics and treatment, especially regarding orthopedic disease. Okay, I'm done talking now. Questions? Yes?
Yes. I've got a parallel. I'm in the cattle industry. and we're in fescue country here,
Mm-hmm.
and we determine as to whether we're doing spring calving or fall calving.
Mm-hmm.
And one of the issues was scours is a lot less if you do fall calving than you do spring calving.
Mm-hmm.
Is there parallels with the horse industry if you foal in the fall as opposed to the spring?
If you figure out a way to get a mare to foal in the fall, I'll pay you lots of money. Mares are seasonal breeders, so they have to be bred when the days are long. Now, there's all sorts of ways we can manipulate the cycles with exogenous hormones, with lights, to kind of trick their body into thinking the days are long. But essentially, all mares are going to foal in the summer and fall, or excuse me, in the spring and summer. So they're bred. It's an 11-month gestation. They're all going to be bred. If you do nothing to them, most mares aren't going to come in heat until March or April, and then they're going to cycle through August. So we don't have that issue. However, fescue is a huge problem in horses, and we could talk a long time about fescue. But if you have a brood mare, you don't want them on fescue. It can cause all sorts of problems with gestation, abnormal milking, urinary problems. So fescue can be a huge problem, but not so much a seasonal problem. It's more just a problem in general. Yes.
Can you expand upon umbilical hernia as far as palpation and diagnosing it? Footnote version?
Yeah, essentially any kind of, when you look at the umbilicus in a foal that's 6 months old, it ought to be sucked up against the abdomen and flat. So if there's a sac there, something that looks like a balloon or an orange, and they can range anywhere in size from a golf ball to a baseball. We've even seen some that are cantaloupe size. So if they have an umbilical hernia, there will be a little bit of an outpouching of the body wall, and you'll be able to get a finger or two up into the abdomen. Sometimes they have guts down in the sac, so it'll be very fluctuant. It'll feel like a water balloon. And you can actually get a finger or two, and we describe them as 1-finger hernias, 2-finger hernias. So how many hernias you can get through the body wall describes the size of the hernia. So a normal foal should have a very flat abdomen, and that umbilicus should be nice and tight up against the abdomen. And essentially, you should not even be able to get a pinky finger up into the abdomen. Okay. Yeah? Did you have a question?
Is it recommended to continually breed mares where they're always carrying a foal for
Yeah.
years and years?
That's strictly preference. As far as how difficult or easy it is to get the mare in foal, the critical thing is what age she's first bred. So if she carries a foal as a 4 or 5-year-old, you're probably not going to have a whole lot of problems with her. The time we get into problems is when the mare is 17 and she's never been bred before, and all of a sudden the people want to have a foal. It's just harder to get them in foal. But obviously, the older you are, the more difficult it is for you to have foals, depending on your conformation. You may have issues there, but it's not critical for a mare to have a foal every year to stay a healthy brood mare. So you can take a brood mare, she can have 2 or 3 foals, you can skip 5 years and come back and breed her again. And other than the age factor, you shouldn't have an issue. But we have the hardest problem with maidens that are old the first time they're bred. Anybody else? No? Okay.